This video is for my fellow pickleballers. I love the game, it's fantastic. I play every Monday night. What we need to talk about is how do we stay on the court, how do we stay healthy, how do we maintain our knee health. So we're gonna run through that in this video on exactly what we need to do consistently to maintain our knee health and keep ourselves on the court, keep us playing. Pickleball is all about lateral movement. So we're moving from side to side, shifting on this hip and pushing off. So I need to maintain my glute health. I need to be strong in my glutes. I need to be able to push off. I need ankle stability. I need ankle mobility. So when we're talking about the mobility and stability of muscles, if we don't have enough stability, then our body cannot maintain mobility. A lot of the times people want to stretch muscles that are tight, but the problem with tight muscles is that they're not strong enough. So our body is reflexively tightening. It's gripping on, hanging on for dear life. It's trying to create that stability, and that's the issue. So we need good, strong, pliable muscles. So same thing that we need at the hip, we need at the ankle as well. Our knee is a consequential joint. It's going to deal with what the ankle, the range of motion of the ankle and the strength at the ankle, and then also the range of motion at the hip and the strength at the hip give it. So if you cut the body in half, right here, we're not going to cut it through the abdomen. So a lot of times, if you want a video on back pain with pickleball, then go ahead and leave a comment and let us know, because the majority of the questions that we've gotten are around knee pain with pickleball. But if you need one, just let us know. So, but this goes into the abdominals. A lot of times people will tell us that we need to be strong in our abs to resist back pain, to prevent back pain. But what I've found clinically is that that's not exactly true. It's about 20% the abdominals, it's 80% the glutes. Because if you cut me in half, I'm going to be cut right here through the hips. So I want to drive through my hips. 80% is the hips driving through, and then 20% is the abdominals. When I reach out for a ball, I'm coming out to here and I need to stop my momentum. That's what my abs are going to do. They're going to stop my momentum. So I'm resisting extension and I'm resisting rotation. They're not prime movers. I'm resisting those motions, but the drive and the movement is coming through my hips. As long as the movement is coming through my hips, then it's not primarily coming out of my low back. And that's what we see with our pickleballers that come in, is that their primary motion is out of the low back. They're doing this and they're not driving through their hips as they come out. We need to define the knee. The knee is right here. We all know that, but we're isolating it too much. We need to think about what the femur is doing right here that connects to the tibia, which comes down to the ankle. So right here, we're looking at the femur coming down. It attaches to the hip right here. The hip joint attaches to the pelvis. The knee bone is connected to the ankle bone, right? So all this stuff is connected. So we need to think about that, because it's going to dictate what happens with the rest of the joints in our body. If we're not strong in our hips, then our knee is going to drift inward. Our hip is going to go into internal rotation. It's going to pull on our low back. So we can have back problems, we can have knee problems, and then sometimes we end up having hip problems, but it's less likely. The majority of the time we end up having knee problems and back problems. So, but we've got to address the hip. The hip is the holy grail of maintaining knee and back health. So what I want to do is think about what's happening at the femur right here, up at the top at the hip, and then what's happening down here at the tibia at the ankle. And so we want to define the knee as the joint that connects the femur and the tibia. When we start doing that, we start addressing above and below where the joint that's causing us problems is. At the glute, our glute wraps around the hip right here. So it goes from here and wraps around this hip and it pulls it out to the side. So if my hip is wrapping, my glute is wrapping around the hip right here, it pulls it out to the side. That falls within the rules of the knee. I want to keep the knee outside the second toe, and I want to keep it behind the toes when I'm doing the majority of my movements. I need to be strong. I need to have a braking mechanism. I need to be able to stop. But I don't need to train knees over toes consistently, because that's going to cause irritation over time. I need to be strong in that position, but I don't want to train it when I'm in the gym. When I'm under load, I want to keep my knees behind my toes, because when I go and play pickleball, it's going to cause some irritation. I'm okay with that. I want to be able to be strong in my hips so I can be more diffuse. I want to spread that stress out between the hip and the knee. As long as I'm doing that, my knee's not going to get overworked. If you constantly put pressure on your knee, it's gonna get irritated. And when I go to cut, if I'm pressing off of my knee, it drifts inward and I'm pushing off the inside of my foot. That's gonna cause irritation and it leads you to an ACL tear. That's what we want to avoid. That ACL tear, also the shear stress on our meniscus, because if we drift in, if I'm constantly pressing off my knee, I'm gonna twist inward. I wanna push off of my hip. If I do that, then I'm protecting my knee long term. Make sure you subscribe to these videos. I don't want you to miss out on the content that we're putting out, because it's the things that get our clients better consistently. We have a 97% success rate here in the clinic, and most of our clients play some type of sport, and a lot of them play pickleball. And we want to make sure that you get that content, you make sure that you're getting better consistently. We don't know where you live in the world. We got to make sure that people are getting quality information out there. The first thing that we have to work on is ankle mobility. I need to be able to bend my ankle to 10 degrees. If you don't have 10 degrees of dorsiflexion, then you're gonna be in for problems, because when we walk, when we run, when we do anything through our gait cycle, we've got to be able to bend to 10 degrees first and then 20 degrees while we're running. If you can't bend that much in your ankle, then your knee's gonna bend early and we're constantly putting pressure on the knee. So we've got to address that. So we do that by doing a calf stretch. We stretch back with the knee straight, and then we maintain with the knee bent. We're gonna go through it again at the end of the video. Second, we need hip mobility. So our hips should be able to move in these directions. So we wanna make sure that we have good external rotation. That doesn't mean we're doing an exercise in standing like this. It means that we should be able to wiggle through our hip, not be drifting on the inside of our knee, because if we're drifting on the inside of our knee and putting pressure on it, it's gonna cause us irritation. So we've got to make sure that we have that hip mobility, and we're gonna give you exercises to make sure that you're working on your hip mobility. External rotation is most important. Internal rotation is important, but only to 35 degrees. If you're over the age of 60, you do not need to work on crazy internal rotation, because with whatever sport you have, you can turn your foot out and you can take up more of that internal rotation by turning the foot out. So we can make adjustments based off of that, and we'll have subsequent videos on that. So you make sure you subscribe, because we'll do subsequent videos on that. That's what's effective for our golfers, for all of our athletes. If they don't have a ton of internal rotation, we're not gonna chase it like crazy. Number 3 is hip stability. We need to be able to maintain our balance on one leg. I should be able to drive my knee out to the side. You should be able to do this. So from neutral to outside like this, I should be able to keep my toe engaged with the ground, the ball of my foot engaged, and I'm pushing out to the side. Maintaining that position, now I've pushed out to the side, and I should be able to step and keep my balance right here. If we can't do that, then we need to go back to some smaller exercises, not in standing, but laying down. And we can do that in a further video. Let us know in a comment that you want to do those exercises, because we got to build our way up. Now, if you can get here and you can just push out to the side, then that's plenty. And then maintain this position. Now, I can do a toe tap, and that's a little bit more challenging. I can put my foot over to the side and I maintain this position. If you want to do this exercise, this is a really quality exercise of maintaining my knee pushed out to the side. I go into a hip hinge and I maintain that. I want to maintain it for 30 seconds for 3 sets, just pushing out to the side. It's like the ball of my foot is engaged with the ground and it's driving it over to the side. By pushing out, my knee should drive out as well, and I maintain that position. 3 sets for 30 seconds, maintaining. By having that hip strength, we're able to have force generation on the outside of our leg. So I'm pushing out to the side and I'm pushing out to the side. So I want to work on my force generation and make sure that I'm doing drills that are pushing me out. So I'm going to drive here, take 2 steps, drive here, take 2 steps, drive here, take 2 steps, drive here. So I always warm up with driving out and using my hips. The issue is, it sounds silly that I'm taking 2 steps and then driving out to the side, but I'm initiating it with my hips. So it's really not a silly movement pattern, because what happens is I go here and my glute isn't fired up. It's not doing what I need it to do. And my body naturally is going to compensate, and I'm going to throw my head this way. And so I'm moving through my back and I'm moving through my knee. It's skipping the hip. So we want to make sure that we're firing at the hip consistently. So I always do 5 steps with each leg, step over 2, and then driving off and driving off and driving off, and make sure that my hip is initiating the movement pattern. We have to work on core stability. This is number 4. It's a major movement pattern that I need to be able to resist motion coming out to the side. A lot of times we'll do pal-off presses where I'd have a band right here on the wall and I'd be pushing out. So it's trying to pull me to the side and I'm resisting that motion. And then also that we can do planks on a ball. So I would lay down on a ball coming up and down right here, and I'm maintaining a neutral position. You can just do planks. Do planks and try to lift. Get on your hands in a push-up position. I'm coming right here. I maintain this position for 30 seconds and I shift my legs apart and I'm coming up, maintaining, and I do 5 seconds holding right there. 5 seconds holding, and I'm working on stability with rotation and extension. I'm resisting extension and I'm resisting rotation, and that's a solid way to work on my core, because 80%, we talked about 80% is coming through the glutes and 20% through the abdomen. That is a consistent thing we see here in the clinic that's beneficial for our clients, is that they work on resisted extension and resisted rotation with the abdomen. Number 5 is a great exercise. It's called a standing fire hydrant. When I'm doing a standing fire hydrant, I want to shift my hips back and allow my chest to come down. I'm putting my hand right here. I'm going to kick back into extension. I'm going to kick my knee out into abduction right here. I'm losing my balance right here. So I'm going to kick my knee out. So it's going back and out, and then my foot's tilting in. I'm doing external rotation. I just squeeze my glute right here. I'm maintaining this position for 30 seconds. You don't need resistance. You can add resistance as a progression, but you don't need resistance right here, because if I extend, abduct, and externally rotate, I'm getting to full motion. I'm getting to the end range of my glute. So my glute is doing extension, abduction, and external rotation. If I got all 3 of those actions right here, then I can maintain this position. And my right leg is maintaining stability at the same time. So I'm holding that for 30 seconds, and then I'm just going to switch, and I'm kicking my leg back out to the side and dropping that foot, and I'm squeezing my glute right there. You can use one hand or two, maintaining this position and keeping core stability at the same time. You're going to get all the actions of the glute, and we're going to be firing it up consistently, and that's what we want to do. We want to get all the glute firing. The more fibers in the glute that we have firing, the better it's going to be when we're playing our sport. Number 5 is a hip hinge. We have to work on a hip hinge. It's a really important exercise that we do with all of our movement patterns, with all of our exercise, with all of our sports, that we're moving through the hips, right? So I'm kicking back and I'm not kicking forward and driving through the knees. So I've got to get a repeated movement going. So I'm going to measure my foot away from the wall right here. I'm shifting my hips back, keeping my face in line with my chest, and I'm driving back. This is not an easy thing to do because it's not a normal movement pattern. We got to redistribute stress to our hamstrings and our glutes. So I'm coming here, maintaining, and coming back. So I'm reaching back with my hips, allowing my chest to come down. My back's not changing angles. My lower leg is vertical right here, but I'm allowing my knees to bend. So before I play pickleball, I'm always doing 10 hip hinges, and then I'm doing 5 with each leg, driving out to the side. So I'm making sure that my glutes fire consistently, so that when it's unconscious while I'm playing the game, that I'm gonna kick and I'm gonna hit and drive through each time. That's gonna protect my knees. Number 6 is that I'm working on hip extensions. I'm going to drop down. I'm allowing my chest to come down. I'm pushing my hips back, and I'm driving. I'm going to squeeze my back glute right here, and I'm driving into that leg. This knee is not going inside the second toe, and it's not going in front of the toes. I'm maintaining this position. I'm getting hip extension stretch. If you're firing your glute, then you're going to get reciprocal inhibition. If I flex my bicep as hard as I can, my tricep has to be loose. So if I fire my glute up, then it's going to relax my hip flexor. So I'm maintaining this position right here and holding it. And I'm going to do that for 30 seconds, and I'm going to switch sides. So if you're at home and you're working on hip mobility, then we want to do that. Prior to doing that, we're going to do a glute rollout. So we want to loosen up the glutes. Number 7 is our glute rollout. So I'm going to grab a lacrosse ball. I want to be right here on the side of my glute. So I'm going to go up against a wall, and I'm going to go straight to the side. I'm going to turn about 30 degrees. Just open up, and then I'm going to drop down into it, and I'm digging that out. Now, I wouldn't suggest you do this against a wall like I am. I would do it against a door. We've had some clients that put holes in walls, and it's like you're putting a lot of pressure into it. And as you get more accustomed to it, when it gets easier, you're gonna put more pressure on it. So we might as well do it against a door and try to avoid putting holes in the walls. I'm gonna dig into this glute. I wanna do about 20 seconds in 3 different spots. So I'm feeling for an area that's tender, and then I'm maintaining that position, and I'm digging. I will move around, but only about a half an inch. I'm just getting a little bit of a wiggle, and I do not want to wiggle through my back. That's not going to be helpful to me. If you're having any back issues, it's going to be a big problem. So I'm just maintaining right here. I'm moving through my ankle, and I'm digging into the areas that cause me pain. And I'm breaking up that tissue so those muscles can glide across each other. Now, that's the first thing that we're going to do. To summarize this video, the first thing we want to do is the glute rollout. We always want to get mobility first. So we're going to get the glute rollout, and then we're going to do our hip hinge, right? Then we're going to get up and we're going to do our hip extension right here. This is a modified world's greatest stretch right here, squeezing that back glute for 30 seconds. So we've loosened up the tissue, and then we've done a hip hinge, fired up the glutes and got some blood flow to them. And then we want to do our hip extension stretch where we're getting reciprocal inhibition. We're firing up that glute, loosening up the hip flexors. Now, I want to work on that exercise where I'm shifting right here, so it's 2 steps, shifting over to the side, 2 steps, shifting over to the side. But when you're playing pickleball, right before you go play, we always want to do those 2 warm-ups where we're going into hip extension, we're doing our hip hinge, and then we do 2 steps and we're driving through. So we're driving out and getting that glute to fire and primarily moving through the hips. By doing that, we're warming up the right muscles, and we gotta make sure that we're doing that consistently. If you wanna stay healthy and you wanna continue to play pickleball, then we need to fire our glutes consistently. We see a lot of pickleball injuries regarding the back and the knees, but 80% is the knees. So we wanna make sure that we're firing the glutes up and protect our knees. But when we fire up the glutes, we're also protecting our low back. So all of this is beneficial, whether it's your back or your knees. Leave a comment if you want more back specific stuff, but these exercises are absolutely essential for us playing quality pickleball. You're going to be more athletic, you're going to be driving through your hips, you're going to be more powerful when you're playing, but we're also going to be resisting injury. And we've got to make sure that you have to take 1 week off. If you've tweaked your knee and it's irritating you a lot, we can't just push through it. We've got to take 1 week off, and we got to make sure that we warm up before we play, so we make sure we're firing the right muscles. Make sure you subscribe to the channel. If you found this video helpful, like it or share it. Make sure you're warming up. We're going to continue to put content out that helps people stay in the gym, stay active, stay mobile, but also play their sports that they really enjoy. So get mobile and stay active.